Oh my god. Let's see. It's been how many months? Oh my god, it's been 8 months since I've been a nurse. And it's been a lot. When people talk about bedside nursing, and how that it's not really the move, I've mentally prepared myself for this, but it's not when you actually go on the floor and work bedside yourself that you actually feel how burnt out you can be from it. Especially when you're working on a floor that's understaffed, it feels like it's not fully resourced with nurses, nursing assistants, secretaries, basically just people. Like, I feel like we have the resources, but just not resources in terms of workers. And the floor that I work on, we get a maximum of 3 to 4 patients depending on acuity, but a lot of the times our patients need to be 3 to 1, but we always get that 4th patient, and the acuity is so high on our floor that it feels like a step down unit. And also there's not much that is being done about it, and so that's where being burnt out happens. And there was a point where I've questioned, like, oh, is nursing even for me? Like, oh my gosh, this is my 2nd degree already. Before I did chemistry and I was a research chemist, and now I've moved to nursing. I've thought a lot about this, and I've realized, like, no, nursing is for me, but I just think the environment that I work in is not for me. And not even that, but it's also like it doesn't feel safe working on that floor just because of how sick the patients are. Yeah. The one thing that I will say is that the floor that I work on, a lot of the nurses are really nice, and they're all really super helpful. They see how busy everyone is. Like, they would without a doubt like ask if we need help with anything, and they, like, they're just really helpful and nice. And I feel like that's the main reason why a lot of the people stay on that floor. This floor that I'm working on is also the same floor that I did my capstone for my last semester of nursing school. So I saw the dynamic of the nurses, and ultimately, like, that is kind of like the environment that I want to be in terms of like how helpful people are and how willing the nurses were accepting of like nursing students and just teaching, compared to like other clinical sites I've had. I didn't really get that same vibe and like welcoming feeling to the floor that I am right now. But yeah, it's just a lot. And I've talked to nurses on the floor. They, a lot of nurses like who are experienced and senior there too, and they do say that, like, yeah, this floor can get really busy, especially for a new grad. I went in as a new hire with like 2 other new hires, and one of the new hires there that I kind of like started out with, she left just because like she realized like the unit that we're on is not really her passion, and it's just also like the acuity is just so high that it's completely understandable. But it's just like whenever I get back from work, I just feel so unmotivated to do anything because I'm just so tired. And yeah, kind of going back to like where I felt like if nursing was for me, You know, I go back and look at my old pictures from nursing school, and I'm just like, wow, like I'm living my dream, but it just feels like I'm just like dragging myself out of bed every morning, that it doesn't feel like a dream. Like it's just a lot and overwhelming. I'm kind of in the beginning though. I was at a phase where I had like pre-shift anxiety, just because I just don't know what I'm walking into. But as the days have progressed, I feel like that pre-shift anxiety has kind of like gone away. And I know that the charge nurse and the nurses around me would help me if I get too busy or if something happens. So I always know that I have people around me that I could ask for help, which is nice because I know a lot of hospitals, they don't really have that work culture. But yeah, I've grown a lot from not knowing anything. Well, I mean, like, you learn stuff in nursing school, but I feel like you learn a lot more when you're on the floor working by yourself. And it's just like nice to see how far I've come. I don't think I regret starting off on this floor, because I have learned a lot, where I feel like if I had went to a different unit, I don't think I would have learned the same amount of skills that I have now in nursing. But I don't think I see myself doing this for like years. Definitely not that, just because of like, unless something changes. But just right now, it just doesn't make me feel happy going to work. Sometimes I don't really know how to describe it. I really don't know, like, I just don't know, like, how to, like, put everything into words, because when I tell people the unit that I work on, they're kind of, like, surprised of how busy we get, because they just think, like, oh, like, you know, you just go in, like, aren't your patients, like, walkie-talkies, like, aren't they stable? But, like, no, like, these patients are, like, so sick, and, like, their diagnosis is just like it affects one organ and then it goes to like another organ, and like it's really complex based on the individual. So it's just a lot of factors that make these patients really sick. And it's also really sad like working on this unit, because a lot of like my patients end up going to hospice, or like they're like super young and they pass away, and it's just hard to just see that. But yeah, anyways, I just really wanted to document this, because I feel like it would be nice to look back on this, and it's like, oh my gosh, like this was really a time in my life, but I've also have grown so much from, you know, this period of like 8 months.